Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at @theimprintnews. You can sign up on our homepage for our free weekly and monthly newsletters, and for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web or at Safe Camp Audio on social media. On this week's episode, we are joined by Natalie Clark, who is the co-founder and co-executive director of the 1999 Collective, and Sarah Goad, who is the state administrative manager for foster care and older youth and education programs at the Michigan Department of Health and Human Services. We are discussing improving outcomes for young adults and the systems that serve them, a playbook of best practices. Now, this is a 25-page guide for really anybody that's involved in the lives of older transition-age foster youth, whether it's the courts, lawyers, caseworkers, advocates, line staff, to understand the core principles that are integral in supporting these young people, along with some specific topics that are front and center in this space. So we talked about the playbook itself, how it's structured and what's in it, but also really got into how it came together. This was a multi-year effort, lots of intense meetings in which a significant group of young people with lived experience were front and center in driving the development of the recommendations. We discussed what makes a good process and co-design, what policies and recommendations really jumped out both to Natalie and Sarah, and about their plans to promote the use of the playbook. I, of course, will include a link to anybody who wants to look at the playbook in the show notes. We also, at the Imprint, have published an op-ed from one of their colleagues, Brina Williams, about the playbook as well. So that will be in the show notes as well, along with a few other resources. So without further ado, here is our conversation with Natalie Clark and Sarah Goad. Okay, we are joined today by Natalie Clark, co-founder and co-executive director of the 1999 Collective, and Sarah Goad, state administrative manager for foster care, older youth, and education programs at the Michigan Department of Health and Human Services, who are among the many people involved in building a recently released playbook of practices around improving outcomes for system-involved young adults. And that playbook was published jointly by the American Public Human Services Administration, Foster Club, and Youth Villages, and it offers plans in 8 subject areas built around 12 core principles that are essential to effectively engaging this group. I will drop a link, of course, to the playbook and everything you need to know about it in our show notes, but let's get into it. Natalie and Sarah, thanks for joining us on the Imprint Weekly Podcast. How are you guys doing?
Doing great. Thanks for having us.
Happy to have you. So let's get these guys to know you a little bit before we get into the weighty topics of the day. Both of them have been apprised that the house rules are you have to give me at least one favorite in our pop culture categories. I'm going to give them to you. It is movie or TV show, book, musical group, or sports team. You only have to give me one. You can give me all 5 if you want. Natalie, I know listens to the podcast, so I'm gonna pick on her first. Natalie, what do you got for us?
I have been obsessing lately over Jasmine Sullivan. She is just an incredible singer. It's not a musician group, but she is just so talented. And I think she's reminiscent to me of some of the older voices from the 90s that I listen to more. She just has some soul in her music that resonates really deeply for me.
Okay, Jasmine Sullivan, everybody. I love a good music rec. I'm too old now. I just don't go and find new stuff enough. Okay, Sarah, I've bought you enough time. Musical group, movie or TV show, book, or sports team. What do you got for us?
Thanks, Natalie, for giving me a little extra time there. So I'm going to give you 2. First, I'm going to date myself with a movie. Favorite movie of all times, always has been, always will be, is Dirty Dancing. So big Patrick Swayze fan still to this day. I can repeat every line of that movie if you put it on. And then music, favorite artist is Taylor Swift. So I have 2 young adult daughters, and Taylor Swift is by far my favorite artist.
So they've pulled you into modern music. Have you pulled them into Dirty Dancing?
Yeah, it's my oldest daughter and I
Nice.
actually love to watch it and repeat every line together. So yeah.
Love that. Okay, so let's talk about this playbook, which was like a couple years in the making, right? Which one of you wants to tell me a little bit about how this came together and what the process was for setting up this discussion? It's a big undertaking.
I can start, Natalie, and you can fill in all the gaps that I will leave. Which is how we work, right? In the collaborative, this is how we roll. The collaborative was brought together by, you already talked a little bit about youth villages, APHSA, and Foster Club, brought together agency officials from across the country. So people like myself in different states and jurisdictions, as well as young people with lived experience in foster care, to talk about how we can collectively work to support young people who have experienced foster care or are still experiencing foster care and really improve and fix our system.
I'd say throughout that whole 3 years, it was a culmination of virtual and in-person gatherings where we were reviewing best practices from all across the nation, different models and standards of care, really honing in on the unmet needs of that transition age youth population and what are the challenges and examples of programs that are actually working for young people and what are things that states and young people with lived experience can come together to implement locally for themselves through some kind of guide, something to be able to say, where can we start? And that place of starting off is starting off with some examples of what's already working.
Yes, and there are no shortage of those in this report. I think, I think of these interviews sometimes, especially when somebody's done something somewhat novel, as like, I want people to listen to this episode and be like, oh yeah, if I wanted to do something like that where I'm at or on my issue, here's a little blueprint. So can you say a little more about it's a bunch of core ideas and then a bunch of specific topics. So what was the process for getting that many people? That's a lot to take on. And as you said, Natalie, I think you said you guys met eight total times over the years.
Yeah, I'd say there's something beautiful that happens just in general when you bring together a force and a group of people that have a drive and a passion for systems change and expertise in the matter that they're talking about, whether that's the group of lived expertise that we had from our young people and the professional expertise that we bring throughout our careers, the state leaders and agencies. But we started off conducting our own research, surveying the young people, human services leaders to learn more about what we actually needed and what the gaps and all of those things are. So step one was making sure the right people were in the room. We had the array of voices from the lived and professional expertise and the organizations. When you say the names Foster Club, Youth Villages, APHSA, those are not just people that are just dipping their toes in the water. These are organizations that have been supporting and uplifting lived experience voices for over the past decade or decades, right? And so we, over the years, have built up a form of understanding how to guide conversations where we can move past just here's the problem into what are the solutions and how do we support other people in the process of reaching those big scary goals that we can all come together and talk about. But until you get the right people in the room that are actually able to say, this is something that we're doing actively in these spaces, or these are examples that we can look towards, it's hard to even have a starting place. What about you, Sarah?
I think one of the other things, I think everything you've said is spot on, Natalie. And I think one of the other things that if someone was looking at how could I do this with my issue or my passion, one of the things that made this very unique and work really well was the co-creation with young people and lead agency leaders, right? So I think sometimes when people hear co-creation or involving authentic youth voice, they think, oh, have one person come sit at the table or ask a group of youth after you've already created something to react to it, which are all great ways to ensure that you're involving youth voice. But this process was so different and really different than anything I'd ever experienced in terms of really everybody in the room or the virtual room was on equal ground, right? So it wasn't like agency leaders or the organizations, say youth villages and foster club. It wasn't like any one entity was like the lead or was controlling the narrative as we were working, but everybody was at the table and was on a level playing field. Young people were bringing ideas to the table. Agency leaders were bringing ideas to the table. Everyone was reacting together, which was, like I said, just a very different process than I'd ever been involved in before. And I think that is what led to just the 12 core competencies that were chosen and identifying those primary domains that we wanted to make sure that we were providing guidance in.
Yeah. Natalie, I'm quite sure this is not the first table you have come to with lived expertise. I hate to hit you with just a very existential, deep question online.
Those are favorite.
Oh, perfect. Okay. But I'm just curious, after having some reps with this, obviously the first step to being inclusive of lived experience is to simply know that you should have people there. So that's a good.
Right.
What, in your experience, are the defining characteristics of effective and meaningful inclusion of lived experience? And take the flip side too, if you would, and just say, based on your experiences, what has felt gross? What has felt like a waste of your time?
Yeah, absolutely. I think I have a really unique experience where the first decade of my experience in this work really was just base level tokenization, right? It was, here's a young person that can come up, tell her story, get some cries, get some emotional reactions, get some hugs, and proceed on and move on business as usual. I had a lot of experiences where, because I was the one young person with lived experience that was doing this work in my state, my name was brought up a lot, but there wasn't a lot of structural support in helping me in the spaces that I was trying to navigate as a young person going to DC and talking to Congress people or lawmakers. And it wasn't until I began this work with Foster Club where I was actually structurally supported with the training and the mentorship and a sense of emotional regulation that I think a lot of people overstep when it comes to bringing lived experts into the field. And so when we started this project with the National Collaborative, I already had a sense of trust in Foster Club because I'd navigated a couple of situations with them where I knew I had 3 prep sessions ahead of actually doing the thing. I had someone that I could reach out to and call to and go back and forth on and spitball and clean up my ideas before actually having to do it. And that's a lot of what the National Collaborative was, is we first built a stage where there was trust and collaboration among our entire group. You received an op-ed from one of our co-collaborators, Brina, and what they said was this was one of the first times where their lived and professional expertise was truly valued from step one. And it was further enhanced through a lot of situations that we had interpersonally, where we were in other states away from home and things come up where in a lot of situations, young people are on their own to just face and figure out. Whereas our team in the collaborative came together to really show up for our young people, whether it was health emergencies or, for me, several flight delays and getting stranded in states and such. You know what I mean? So
where'd you get stranded? What was the worst state?
Oh, I actually just recently got stranded while we were out in DC this year, but that wasn't the first time I'd gotten stranded DC last time. But the way the team showed up 1:00 in the morning to say, okay, we're gonna find you a room, book you here. Another person is trying to work on getting me a flight for the next day out so I can make it to this meeting that I needed to be at home, right? And so it was a community that showed up and really cared, not just through words or saying the right things or advancing something that will support young people, but on a personal and genuine, authentic, human to human level, we were seen and valued as a team. And I think that really is what will always stick out to me as the most important thing in this.
Let me tell you what I took away from that. Thank you for all those thoughts.
Yeah.
I know I get Sarah's thoughts on it too, but you started with what certainly on Capitol Hill in DC is often the case. Somebody is there to testify.
Yep.
They testify and it's incredibly emotional.
Yeah.
Which is effective. I mean,
it does.
And can be gross.
It has.
So it is, I have literally seen laws where I'm like, I don't think that law passes if it wasn't for the young person that came into their story. But that doesn't mean it can't be gross, because I think if I'm hearing you, we used to, and maybe some people still do, trot that person out there without a lot of prep and without a lot of emotional support.
Precisely.
And
That's
here
the
you
key.
guys are creating almost like this. If you look at the playbook, it's a platform from which many young people could go tell their story and be trained. So we've gotten a little better at the process before that. Sarah, does that sound right to you? You've probably seen what I've talked about on the state level before.
Yeah, definitely. And I think Natalie hit the nail right on the head. The difference is the preparation before that's happening and the debriefing after, right? Because because there is power in people sharing their stories, right? Storytelling is a really important part of changing systems. But if you are not helping a young person who's sharing very vulnerable experiences that they've had, if you're not prepping them for what they're going to experience and then debriefing with them after, then you're part of the problem. Really, honestly, you're part of the problem if you're not providing that prep and that debrief afterwards. And I think it happens often. And I don't think that it's done from a place of malice. I think agency folks all over the place, right? We want to include a youth voice, but people don't understand what that means always and how to do it authentically. And so that's something else that is in the playbook, in addition to those core competencies and those areas of change that we talk about and how to do that. There's information on how to authentically engage young people.
Yeah. So let's talk about those. The way that this playbook is structured, and again, go to the show notes and you can see a link to it. This sort of lays out these core competencies of serving older system involved youth, or being in their lives, really, not just serving them, and then moves to specific areas of their lives where diligent efforts are needed to help support them. And I like that it then kind of blends those together. As you're reading about the specific issues, it's pointing back to, here's the core competencies that relate to this thing. So we definitely don't have time to go through all 12 core competencies in all the different sections, but I'll just list them here before I ask you guys to talk about it a little. But the competencies are trust, choice, collaboration, empowerment, community, security, safety, well-being, permanency, relationships, respect, and opportunity. And then those are weaved into these sections that are specifically about some issue areas, and those are education, employment, permanency, community connection, housing, going beyond basic needs, health, and extended foster care. So it's some high concept stuff and some specific, more policy-oriented stuff. And going back to what we were talking about before, like, how did you guys decide on these? And feel free to share if there's ones in particular that stand out to you or what.
Again, just through the research that Natalie talked about that kind of happened at the start of this process, looking at what are all the areas that are important. And as a group, we really talked about, I don't even know how many different competencies we had when we started.
I feel like we had well over 20.
Yes, wow. We had so many. But then we started thinking about which ones of these things kind of align with each other and can kind of tuck in under another category. And even at one point, I think safety was one, and that got split out into safety and security. And that was because we had lived expert voice that was saying, these are really, like, safety means two different things. It means my physical safety, right? But it also means security, and that I feel that I have security in my relationships. And so we looked at breaking that safety apart into those two categories. So there was a lot. It was a process, a big process of just like talking through these things and coming to shared agreement around these. These were the 12 competencies or 12 things that really we felt weaved throughout every experience that young people have. Natalie, anything that I missed there?
I would say the conversations got really specific. And I think for me, we started off with so many, and it's hard to say that even just 12 is enough. I think even in the conversations that we had, we were supposed to only have 11. And then like Sarah said, we had to expand the two of those because through conversation with young people, pointing out the differences in all of these things and pointing out examples of what those were in their story that were successful or examples of where these competencies were missing. That was essentially the driving force of how we knew which ones to prioritize, because we had the examples of how helpful it is when something like safety, security, or permanency is in place for a young person in their transition versus what the outcome or experience for us is that didn't have those things. And I think the weight of the dialogue around young people who've experienced it ourselves was the driving force the whole step of the way.
And this is one of the places I would say that as agency leaders, we really had to step down, right? And allow lived voice to amplify here, because we have a systems perspective and a professional perspective of what we might think are the most important things, but we aren't the ones that have lived through it. And so we really had to step down and let them be the experts.
If I could put you on the spot there a bit, Sarah, was there a particular competency or issue area that you didn't see coming that is here because of that dynamic you're talking about?
I don't think that there's anything that I didn't see coming, but I would say, again, that all that conversation that really happened around splitting out safety was one that I certainly had not thought about it in the way that young people expressed it during our conversations, right? To me, safety was safety, and it meant all of those things. But to our collaborative members, it really was very important that we separated those out so that people could see that they are two distinctly different ways of being safe.
Nobody said adoption and foster care were easy, but it's easier when you're not alone. The Families Rising Adoption and Foster Care Conference brings together hundreds of adoptive, foster, and kinship parents, lived experts, and child welfare professionals. Together, we'll talk about the tough stuff in child welfare, bring hope to our kids and families, and of course, earn CEUs while we do it. Let's get refreshed and re-energized to serve kids and families in need. All at the virtual Families Rising Adoption and Foster Care Conference on October 21st and 22nd. Register today and take advantage of our early bird rates at wearefamiliesrising.org/conference. That's wearefamiliesrising.org/conference.
As I read through it, it occurred to me that you guys have compiled this very robust matrix of ideas layered around competency, along with just truly a great collection of examples. I like that about it. It's an orderly for a disorganized mind like myself. It was very helpful that it has good structure to it and predictability in a good way. But it also occurred to me, people are going to want to say, well, what'd you find? What is the what is that one line takeaway? So I kind of thought about it myself, and here's mine. I'd love to hear how you would describe the totality of this thing. But my big takeaway, as you just condense all of this stuff that you guys have put together, was effective young adult development means you're doing what you can to facilitate human connection, a safe situation, and opportunities, all while being guided by the choices and views of the youth in front of you.
Oh, wow. We need that on the cover. Oh, my gosh.
I do this for a living, you know?
Can we print that on the back as like a quote from the John Kelly in our second edition?
We'll clip it. We'll put it out there as audio. That's fine with me. But the reason I thought it was an important exercise for myself as I was like thinking about this is it almost sounds deceptively simple. Especially that last part, while being guided by the choices of the youth, because I think that's the hard thing. It's a variable for the adult to reckon with, and then vice versa, what options are being presented to me or what's available for the young person. So anyway, but that's going to be like, you're going to have to get up and tell people like, oh, what's this like 25-page thing about, and nail it in a line sometimes. It's like a part of advocacy. Let's talk a little bit about the final recommendations, because I should have pointed this out. There's in each issue area, there's these examples of people doing interesting things already, but then there's also some sort of like calls to action specific to them. And then you end on this mix of specific policy stuff, like increasing Chafee funding and investing in more in federal funds for housing, but then also some kind of conceptual stuff like co-designing systems, creating flexible funding mechanisms that are just better at individualizing support for people. I had a couple questions on ones that were like interesting to me that I hadn't really thought about, but I first wanted to put it to you guys. Of those final recommendations, any that you guys are particularly passionate about or think need to be front of mind for policymakers in this next year or so?
So interesting that you're asking this. So one of the things that we recently did was we had the opportunity to go to the Hill and speak with a number of different legislators and share one, the awesome opportunity that we had to create this playbook, to share the playbook, to share our experiences, but then also to talk about some of these priority areas with them. And I think I would say the two that really resonate with me and that are kind of top of mind for me right now are both the co-designing of systems. Again, just my experience with this process has really opened my mind to the importance of doing that and how it can really provide us so much more information and opportunity than the way that we kind of currently do things. And then the other one was really the promotion of interagency collaboration. So I think we end up, at least from a systems perspective, we all are in our own little silos trying to serve people in these separate buckets. And while we are often serving the same population, and in this instance, we're serving older youth who are experiencing or have experienced foster care, we are doing it from our own little silos. And there are regulations that we all have to follow. And so sometimes those become enormous barriers for both the young people that we're trying to serve, but also for our systems. And it can be very frustrating. So really anything that can happen to promote that interagency collaboration, whether it's just overarching guidance that like, hey, if you are collaborating, some sort of incentives or waivers to regulations to be able to collaborate. I think those things can really open up opportunities for our young people, but also for us as agency leaders.
Yeah, probably those two things go hand in hand too, because I feel if you had young people have experienced it advising you, they'd be like, if I'm in foster care and I'm getting counseling and I'm looking for housing, I don't need three points of contact for that. Probably just one person to help me. It'd be great.
Yeah. Three different systems to navigate.
Exactly.
Right?
Yeah.
Different rules.
Exactly. Natalie, any that jump out to you that Sarah didn't pick?
I think obviously she already touched on the co-design. I don't think anything that we create that's actually going to be successful on the ground can be successful on the ground without co-design at the very forefront. But I'd also say prioritizing increasing funding for Chafee funding, as we're operating on 1999 funding with 2026 problems. And Chafee was the first and only federal piece of legislation that goes to every state. If I wouldn't be here with a master's degree and a decade in advocacy without Chafee funding. And one of the biggest reasons I started my nonprofit was because young people weren't accessing Chafee the way that they needed to. And we know that's because, honestly, the way it breaks down isn't as effective as we need it to be. It doesn't reach as far as we need it to reach. So I think prioritizing the older youth population through Chafee funding would be one of my top.
Yeah. And I think we're starting to see that really come to a head where now there's ideas on the table that not only move Chafee forward at its old line, but we're maybe going to dilute some. DTV is going to get doubled in max, but without more money. And
how are we going to do that?
I think people have feelings in different directions about that very thing.
I think it's great to pass legislation that helps young people, but if there's no fiscal dollars behind that as inflation increases and as needs are identified, then I think we're doing a disservice to young people sometimes.
Who told you about Chafee? How did you find out you were eligible for it?
I got really lucky and I had a rock star of a transition to adult living caseworker that just made sure I got connected to every funding stream that was available and got the unicorn. And that's the best way I can describe it, because so many other young people in my community did not have that same experience. And it was all based on my caseworker.
Sarah, not to lay all the problems of that highlights at your table, but why is that a unicorn scenario still? What is holding us back from having more uniform awareness of what is possible?
Yeah, no, and that's a really good question. And I think it's something that we've had a lot of discussion around this in our groups. And I think as I think about it, I think one of the biggest barriers for our older youth getting information about services and resources from their case managers is often the breadth of information and responsibility that our case managers have, right? So if you are expected to serve youth from the age of 0 to 21 on your caseload, because Michigan has extended foster care, and our case managers could be serving anyone from the age of 0 to 21, specializing or having knowledge in either end of that spectrum can be really difficult. And I think one of the other things that I really learned and that became even more apparent to me through this process over the last few years is that we have been trying to serve young adults who are accessing adult services in a child's system, right? So really needing to reframe the way that our case managers and our systems approach the services and supports that we're providing for this population. I think that's really important because they are not children. They're stuck in this in between, right? They're not children, and the services that they need are often in the adult system, but they're also still children, right? I have young adult daughters, and I can't imagine them having turned 18 and just being like, okay, go figure it all out yourself now. You're 18. Mm-hmm. So they need those specialized supports still.
And I think nothing epitomizes what you're describing probably better than the research that I will also link to that's also done by this, because I'm part of the playbook, but you guys went into some research about extended foster care in particular. And why are people in it? Why aren't they in it? What are their experiences in it? And of the very significant percentage of 18 to 21-year-olds who do not avail themselves of extended foster care, 44% of them said they didn't participate because they didn't know about it. And not to excuse youth not being aware of ETV, which is bad. Not knowing that you could have at least to remain, it almost seems intentional and not careless to me. I'm not saying that from state. I'm sure it varies from state to state, but there feels like there might be financial incentives to not telling people when you can get away with it. I'm just going to throw that out there. That's it.
Definitely. And I think that's one of the reasons that this is one of the 8 primary calls to action for legislators is really maximizing the use of extended foster care and having some standardization around it, because it is very different state to state what is offered, eligibility criteria. And there's some very high-level eligibility criteria to access the federal funding, but criteria can be different state to state for youth to enter, maintain, or return to extended foster care. And it's not fair, right, for young people who have ended up in foster care at no choice of their own to have such different experiences or resources or things available to them just because of rules or not having that standardization.
2 of the final recommendations that one just kind of is rare that I just stop in my tracks was expanding family first to support young adults aging out of foster care. I thought about it for a minute and I'm not sure how it works, because the sort of ticket to get into services under Family First is being a candidate for foster care. And it's really rooted in substance abuse and mental health services. So what was the thinking there? Where were you guys going with it? Because maybe I'm not thinking of this in the right way. How would that work?
I think there's a couple of things. One, there is the piece around pregnant and parenting youth who can access. I think the idea is preventing the continued connection to or generational return to foster care for young people who are leaving our system, right? So providing them prevention services, it really tying into even just the basic things that we've already talked about: housing, mental health services, if there's substance abuse needs, tying them into those services to prevent them from continuing a cycle of foster care as they build their own families.
Gotcha. Okay. And then the other one was the Medicaid part, because, I know nothing is implemented perfectly, but the Affordable Care Act expanded Medicaid eligibility of foster youth up to 26. And then we closed I don't remember exactly what year, but we closed the loophole where technically if you moved to another state, that state wasn't on the hook to do it. So what's left to do? I wasn't quite clear from the wording and the recommendation. Is it just making sure people are actually living up to that, or do we need more policy here?
I mean, I think it's kind of closing those loops state to state, making sure that it's something that youth can access no matter where they go, right? It's, again, that's one of those things that it's a youth who's experienced foster care through no fault of their own, who wants to move somewhere else. They shouldn't be tied to staying in the state that they're in just to be able to access services and supports.
Yeah. Natalie, is this something you encountered?
Bingo. She said it exactly correct. I didn't actually qualify for Medicaid when I left state's custody. So but that is something that I see for a lot of my young people that I work with through my nonprofit. I have young people right now that are getting accepted into top-notch universities. They've worked so hard to qualify for full ride scholarships. And now they're having to decide if they should stay here for medical coverage, or if they should chase their dreams that they've worked their entire life to get. And it breaks my heart that any young person has to choose between receiving medical coverage and chasing that upward mobility that we're all told that is a really big deal and is what we're supposed to do in life when we're wards of the state and we were children of the government, and the government is nationwide, Medicaid's nationwide. It seems like a barrier that just has no place existing.
But doesn't it not exist anymore? Is it a perception or practice? Because legally, they should already be able. They shouldn't have to worry about that. We changed the law. So what's getting in the way? They're not practice. People are just not doing it. Okay. Yeah, we should fix that. That's a good recommendation then. Okay. I'll get you guys out of here on this. I just simply want to know what the process is from here. You spent years putting this into the world. What is the strategy for making use of it? What are you guys going to do with it?
That's a really good question.
Yeah, I think while the process of developing it is done, we are just launching with what we're working on right now, right? So we're doing things like having a great opportunity to come and chat with you today. And so hopefully sharing this out will get other people curious and have people reaching out for information about the playbook, accessing the playbook. It is a living document, so I think it's something that we will continue to pour new information, ideas, examples into. And really, I think we're all individually that have been on the collaborative trying to share this information for me, I'm sharing it with colleagues within my own state. I'm sharing it with colleagues from other states and encouraging people to just jump in if there's an area that you're trying to work in, whether it's housing or education, whatever it might be. Jump in, just look at that section for now and start asking questions. Take the first steps.
Yeah, I think one of the biggest priorities always when it comes to coming out with new information like this is making sure it gets to the communities that it needs to reach in a timely and effective manner. So everything from interpersonal, working within our communities and our networks to make sure it's disseminated, all the way to holding national online meetups with young people in every state to make sure they have access to it, truly ensuring that the dissemination gets to all of the stakeholders that matter most. And like she said, really ensuring that this doesn't become just another outdated piece of information. When I was starting to learn about how to change the system, I would find a guide that looked really cool, but it was a decade old or 5 years out of practice. So making sure that this is up to date with all of the changes and improvements that we make so that it can always remain something reliable for states and communities and young people everywhere to truly rely on and look forward to for next steps.
I think one of the other things that we didn't really mention too is that this isn't, a lot of times you'll find a guide that is geared towards policymakers or geared just towards agency staff, right? And this guide is for anybody. So it is for an agency leader to pick up and utilize. It's for policymakers to pick up and utilize. It's for young people with lived experience who want to advocate to pick up and start with. So it really can hit all of those different audiences. And I think that's another thing that really makes it unique.
It's called Improving Outcomes for Young Adults in the Systems That Serve Them, a Playbook of Best Practices. I will, again, put this in the show notes. Click on it, read it, share it widely. Sarah Goad and Natalie Clark, thanks for joining us on the Imprint Weekly Podcast.
Thank you for having us.
Thanks to Natalie Clark of the 1999 Collective and Sarah Goad of the Michigan Department of Health and Human Services for joining us today. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at Safecamp Audio on all major social media. This podcast is produced and mixed by Christine Onjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you would consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is very easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. You can always get us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.